Hello guys, let us see a small topic in the OBG subject. In the OBG, one unit is there, that is disorders during a pregnancy. In that, now we are going to see disorders due to amniotic fluid volume. Amniotic fluid. Amniotic fluid is a clear, slightly yellowish liquid that surrounds the unborn baby, means fetus, during pregnancy. It is present in the amniotic sac. Amniotic fluid is a clear, slightly yellowish liquid which is present in the amniotic sac. See, in this picture you can observe this is the amniotic sac. This is the amniotic sac where the amniotic fluid will be there. See here where the arrow mark is there, no? There you observe this is the amniotic fluid. This is the amniotic fluid which is surrounding to the fetus. This is the amniotic fluid and this is the amniotic sac. We will call it as a amniotic sac. And here the amniotic fluid will be there. A normal amniotic fluid increases in amount throughout the pregnancy until it reaches its maximum level, that is 1 liter at 38 weeks of gestation. Amniotic fluid normally decreases by 38 weeks onwards. By 40 weeks, 800 ml of amniotic fluid will be there, and 42 weeks 400 ml of amniotic fluid, and at 43 weeks 300 ml of amniotic fluid. Normally the amniotic fluid will be keep on increasing its amount throughout the pregnancy. It reaches its maximum level is about 1 liter at the 38 weeks of gestation. Amniotic fluid normally decreases by 38 weeks onwards. Next, moving on to the disorders of amniotic fluid volume. There are mainly two abnormalities are there, that is polyhydramnios and oligohydramnios. Polyhydramnios also called as hydramnios and oligohydramnios. In this video, now we are going to see only the oligohydramnios. First we will know what do you mean by poly and what do you mean by oligo. Poly means increasing, oligo means decreasing. So polyhydramnios is an excess amniotic fluid which exceeds 2000 ml, more than the 2000 ml also. That is called as polyhydramnios. Oligohydramnios is nothing but abnormally a small amount of amniotic fluid which is less than 300 to 500 ml at term. That is called as oligohydramnios. We will see now what are the causes for oligohydramnios. I told you that in this video we are going to see only oligohydramnios condition. So what are the causes for decreasing of amniotic fluid means? The first and foremost cause is unknown. We don't know what is the exact reason for decreasing of amniotic fluid. Other risk factors are there like fetal causes. PROM. 50% of all the oligohydramnios mothers will be having a PROM. PROM is nothing but premature rupture of the membrane. Premature rupture of the membrane. Once the membranes ruptured, prematurely if the membranes ruptured, there will be a leaking of amniotic fluid. Due to the leaking of amniotic fluid, there will be a oligohydramnios. Next, a chromosomal anomalies. Chromosomal anomalies like Down syndrome, spina bifida, etc. Those disorders will causes the mother to have a oligohydramnios. Next is IUGR. IUGR is nothing but intrauterine growth retardation. Next, IUFD, intrauterine fetal death. Due to the intrauterine growth retardation as well as intrauterine fetal death. It is nothing but inside the uterus. Intrauterine means inside the uterus, the fetal growth retardation will take place. At the same time, inside the uterus, the fetal death will occur. Due to these two reasons, the mother may go for the oligohydramnios. Next is postpartum pregnancy. Postpartum pregnancy. These are the fetal causes. Next, placental causes like chorionic abnormalities. Chorionic abnormalities. Next, moving on to the maternal insufficiency like preeclampsia, hypertension. Preeclampsia and hypertension is nothing but increasing of blood pressure. Increasing of blood pressure during the pregnancy. That is called as hypertension and preeclampsia. Next, during the pregnancy, if the mother is having a diabetes mellitus. Next causes for the oligohydramnios is using of certain drugs like PG synthetase inhibitor. PG means prostaglandin synthetase inhibitor like NSAIDs. Next, ACE inhibitors like captopril. If the mother using these drugs, that will leads to a oligohydramnios. These are the some of the causes for oligohydramnios. First cause will be the unknown. We don't know what is the exact reason, but some of the risk factors are there like fetal causes, placental causes, maternal insufficiency and drugs. These are the some of the causes for oligohydramnios. Next, moving on to the signs and symptoms. What are the signs and symptoms for the oligohydramnios? We will see now. There is no specific signs and symptoms will be there. There is no specific symptoms will be there. Like the mother will have a history of leaking per vaginally. Leaking per vaginally. Okay. The mother will complain that I am having some of vaginal leakage. Okay. Fluid leakage will be there. Like that the mother will tell the history. And there will be a post-term history will be there, and there will be a history of CHT means hypertension. Okay, hypertension and preeclampsia, and there will be a usage of certain drugs and less fetal movements. These are the some of the symptoms the mother will be telling to the nurses as well as to the doctor, gynecologist, okay, and obstetricians. So what are the symptoms she will explain means she will tell that I am having a pervaginal leaking. Okay, pervaginal leaking, and if you are gathering the history, then through the history we will come to know if the mother is having a preeclampsia, hypertension and certain drugs usage or less fetal movements. These are the symptoms. Next, moving on to the signs like what are the signs what we can observe means the uterus will small for the date, small for the gestational age. Next, malpresentations will be there. IUGR. IUGR means intrauterine growth retardation, and if you are assessing the fetal heart rate, normal will be there or else it will be non-reassuring. Next, small columns by ultrasound. If you are doing a ultrasound, through the ultrasound we can identify that there will be a small columns. Next, moving on to the diagnosis. Okay, in the diagnosis we have to gather the history. Whatever the symptoms I told you know, like a history of maternal age, history of drugs usage, history of any previous congenital abnormalities of the fetus, like that history we need to gather. And physical examination. In the physical examination we have to identify the uterine size. Usually the uterine size is much smaller than the period of amenorrhea, and less fetal movements will be there. The uterus full of fetus. Uterus will be, when we are palpating the uterus, we can feel the uterus full of fetus because of scanty liquid. Next, malpresentation, commonly breech presentation will be there, and evidence of intrauterine growth retardation of the fetus, and sonographic diagnosis is made when the largest liquid pool is less than the 2 centimeter. Okay, when the liquid pool is less than the 2 centimeter, then it is diagnosed that mother is having a oligohydramnios. Okay, amniotic fluid index we need to take through the sonographic diagnosis. When we are identifying the amniotic fluid index, if we are getting less than the 2 centimeter, then it is confirmed that mother is having a oligohydramnios. Oligohydramnios with fetal symmetric growth retardation is associated with the increased chromosomal abnormality. In the sonography, if you are identifying the oligohydramnios, along with that, if there is a growth retardation is there, fetal growth retardation is there, means it indicates that there will be an increasing of chance of chromosomal abnormality. Then we have to advise the mother to go for further analysis. Next, moving on to the management. The management will depend upon the causes, gestational age, severity, fetal status and well-being. Okay, we have seen some of the causes, no? So, by concentrating on the causes, we have to give a treatment. For example, I told you in the cause, 50% of the oligohydramnios cases will be having a premature rupture of the membrane. So, in case of premature rupture of the membrane is a cause, then we have to treat the premature rupture of the membrane first. Then we have to go for the management of oligohydramnios. If the mother has completed the 38 weeks of gestation and if she is near to the term, okay, if she is near to the term, then we can advise the mother to go for the delivery. Okay, do go for the delivery. Okay, already the membranes has been ruptured, right? So, we can advise the mother to go for the delivery. Like that, based upon the causes, we have to give a treatment. If the cause for the oligohydramnios is a using of certain drugs, means we have to withdraw the drugs. Like that, based upon the cause, we have to give a treatment for the oligohydramnios. And based upon the gestational age, based upon the severity of the oligohydramnios, and based upon the fetal status and well-being. If the fetus surviving in the extrauterine life, then based upon that, we have to give a treatment. What is the actual treatment means? We have to provide adequate rest to the mother, rehydration by giving a oral or IV hypotonic fluids 2 liters per day and decreasing the dehydration, amnion infusion by normal saline during the labor to prevent umbilical cord compression. See, the baby will be surrounding with the, fetus will be surrounded by the amniotic fluid. So, when the fetus is surrounded by the amniotic fluid, if the amniotic fluid decreases or else if the amniotic fluid comes out, then the fetus will go and compress the umbilical cord. Okay, once the fetus go and compresses the umbilical cord, there is no oxygen supply to the fetus. So, the fetus may go for the death. To prevent that, we have to go for the amnion infusion by normal saline during the labor. Okay. Next, complications. What are the complications means? Maternal complications are there, fetal complications are there. What are the maternal complications means? Increased morbidity, prolonged labor, increased operative interventions, abortion. These are the maternal complications. Next, moving on to the fetal complications like prematurity, intrauterine fetal death, malpresentation, fetal distress, low Apgar score, fetal malformations and stillbirth. These are some of the fetal complications with oligohydramnios. So far we have discussed regarding what do you mean by amniotic fluid, what are the normal volumes of amniotic fluid and what are the disorders due to the amniotic volume. When the amniotic fluid volume increases means we will call it as a polyhydramnios. When it decreases means we will call it as a oligohydramnios. And Mainly in this video, we have seen regarding oligohydramnios. This is very small topic where next video we will continue with the polyhydramnios. I hope all of you have understood regarding oligohydramnios. Thanking you.